Good morning, everyone. Today, I will walk you through our theoretical article titled The Proximity Paradox, Relational Distance Moderating Leadership Cultural Transmission in Healthcare Complex Adaptive Systems. Our session is structured as follows. First, we will identify the core problem in the transmission of healthcare leadership. Next, we will develop the theory by integrating dimensions of relational distance, leader-member exchange, and complex adaptive systems. After presenting our framework, we will outline 5 testable hypotheses. I will describe how we plan to test these hypotheses through a longitudinal social network study and the analytical strategies we will use. Finally, we will discuss the implications for theory and practice and conclude with some limitations and final thoughts. Healthcare organizations are notoriously hierarchical with steep power differentials among administrative leaders, physicians, and frontline staff. Most leadership research implicitly assumes that a leader's transformational behaviors translate uniformly into cultural change regardless of the relational context. However, recent qualitative evidence from tertiary hospitals reveals that leadership distance and power imbalances foster a culture of hierarchy and silence, leading to mere symbolic compliance rather than genuine adoption of initiative. This suggests that relational distance systematically moderates whether leadership messages are internalized or ignored. The gap is clear. We need a model that explicitly accounts for how the distance between leader and follower filters cultural transmission. Now, let's take this opportunity to explore the theoretical foundations in greater depth. Relational distance is a multi-dimensional construct. It comprises of 1. Physical distance, how far apart workspaces are, which reduces informal communication. 2. Social distance, a demographic and professional similarity that shapes in-group favoritism. 3. Psychological distance, which is the level of trust and psychological safety that affects willingness to be vulnerable. And last, structural distance, which is the number of hierarchical layers and informal power differentials. Mehravic and Goswami stress that these dimensions are intertwined. One form of distance can amplify or offset another. For example, close physical proximity may not help if the psychological distance is vast. These dimensions are not just theoretical. Song found that placing hospital patients physically distant from their home service unit increased length of stay by 22.8% and raised readmission risk because physician-nurse coordination dropped. This operationalizes how partial separation degrades relational coordination. More recently, Buckles showed that post-phubbing, which is leaders prioritizing smartphones over face-to-face interactions, undermines supervisory satisfaction, particularly for employees with low power distance orientations. In a completely different context, Hunt documented deteriorated relationships in Chinese coal mines due to structural hierarchy, with over 1/4 of minor supervisor diets classified as deteriorated. On the psychological side, Law used stochastic action-oriented models to reveal that psychological safety in interdisciplinary teams co-evolves with communication ties. All these findings underscore that distance moderates influences. Leader-member exchange theory recognizes that leaders develop differentiated relationships. High-quality changes are categorized by respect, trust, and mutual obligation, with low-quality exchanges remain at the level of contractual compliance. LMX differentiation refers to the degree of variance in relationship quality across a leader's team. In healthcare, this differentiation can be extreme because a single leader manages diverse professional groups like physicians, nurses, and administrators, each with distinct status and autonomy. Thus, even among followers who report to the same leader, relational distance vary considerably, creating a patchwork of transmission fidelity. Now, let's overlay a complex adaptive system lens. In a cast, agents are heterogeneous and interact through local rules, and system-level patterns emerge from these interactions. Relational distance is a key source of agent heterogeneity as it shapes how a leadership input is received, interpreted, and enacted. Consequently, transmission fidelity, the degree to which follower response matches leader, depends on relational distance. High-distance relationships can produce attenuation, distortion, or delay. Crucially, cast theory predicts nonlinear phase transitions. Wilson simulated healthcare quality improvement and found that a critical threshold of shared understanding was required before success became probable. Below that threshold, failure cascades dominated. We argue that leadership cultural transmission undergoes similar threshold dynamics. This brings us to the core proposition, the proximity paradox. We hypothesize that leadership cultural transmission follows a distant decay function with nonlinear thresholds. When relational distance is low, transmission is high and faithful. As a distance increases, effectiveness gradually declines, but only up to a critical point. Beyond that threshold, transmission drops discontinuously rather than gradually, creating cultural bifurcation. Proximal followers adopt the intended cultural change, while distal followers remain in their original subculture. The metaphor of a phase transition from physics is apt here. Just as water suddenly freezes at 0 degrees Celsius, cultural transmission can snap when the relational gap becomes too wide. The framework also incorporates LMX differentiation. Leaders with high differentiation will produce even stiffer decay slopes because the distance gap between the in-group and the out-group is larger. From the framework, we derive 5 testable hypotheses. H1, transmission effectiveness will exhibit a negative distance decay function controlling for alternatives. That decay will be nonlinear with critical thresholds causing a sudden drop consistent with the inverted shape LNX differentiation effects recently shown by Lim Ee Ai. And these dimensions interact. Low structural distance can buffer the negative effects of high social distance because constraints on formal hierarchy are relaxed. And H4, the LNX differentiation at the leader level moderates the slope with high differentiation leaders generating steeper declines. Finally, H5, over time, relational distance patterns will predict the emergence of cultural subclusters with proximal followers sharing one set of assumptions, while distal followers another set of assumptions. This explains persistent subcultures despite uniform leaders' messaging. To test this hypothesis, we propose a longitudinal social network design with 4 waves over 24 months. We will recruit about 200 staff. across 12 to 15 departments, including roughly 30 leaders and followers at various hierarchical levels. Quantitative measures will include the LMX7 scale, a custom relational distance, composite, and compensing all 4 dimensions, the multi-factor leadership questionnaires, the organizational culture assessment instrument, and a social metrics survey capturing communication frequency, advice seeking, and trust ties. To add that, we will conduct semi-structured interviews with 30 participants to explore relational experiences and narratives of cultural transmission. Our analysis is multi-pronged. For the cross-sectional network structure, we will use exponential radiant graph models to test whether relational distance predicts time formation. To model core evolution of networks and cultural perceptions over time, we will apply stochastic actor-oriented models, just as Amati did to link inter-hospital referral networks with internal organizational activities. Multi-level modeling will estimate the shape of distance decay function across individuals and departments. Finally, qualitative comparative analysis will identify which combinations of distance dimensions produce sufficient conditions for transmission failure, allowing us to pinpoint critical threshold empirically. This mixed method network approach let us capture both structure and life experience. If supported, our research will make several contributions. Theoretically, it positions relational distance as a boundary condition for transformational leadership impact and extend LNX differentiation into a complex adaptive system. Empirically, it extends existing cross-sectional work by providing a longitudinal test of distance decay transmission mechanisms that have been theorized but not yet traced over time in healthcare settings. Practically, the findings can guide multi-dimensional interventions, helping leaders tailor bridging strategies to specific distance gaps. Of course, this research has its limitations. The research is a theoretical proposal. The hypothesis awaits empirical testing. General stability beyond healthcare in the Malaysian context is uncertain. Future studies should examine cross-cultural variations, as Barkhouse noted. Power distance orientation colors how followers respond to relational signals. With remote work, virtual leadership introduced new forms of distance that may have different decay patterns. Another intriguing question is whether leaders can actively manage phase transitions using insights from catastrophe theory. Can we shift the critical thresholds to allow high fidelity transmission at greater distances? Finally, the inverted U effects recently observed in L and X differentiation suggest that we should explore optimal middle ground configurations rather than simply minimizing all distances. In conclusion, the proximity paradox framework positions relational distance as a critical control parameter in healthcare complex adaptive systems. It explains why uniform leadership programs so often produce splinter cultures. When the relational gap exceeds a threshold, transmission snaps, creating cultural bifurcation. The 4 dimensions of distance, physical, social, psychological, and structural, interact and can be addressed through targeted multidimensional strategies. While empirical validation is the next step, we believe this model provides both a theoretical foundations and practical guidance to bridge the relational divides that stall cultural transformation in hierarchical healthcare organizations. Thank you very much for your attention. We hope you will enjoy us in moving from paradox to practice. Here are the key references for those interested in exploring further.